Hey everyone, we're just going to give people a couple minutes to sign on. It's just 8 o'clock right now, so we'll wait till we get a couple people on. All right, so I'm Dr. Emma Paul McLeod. I'm one of the naturopathic doctors who works at Nutrichem Clinic and Pharmacy. So we have the compounding pharmacy, 2 locations in Ottawa, Ontario. So I'm one of the naturopathic doctors, and I'm here today with Adam Livingston. He has his Doctor of Pharmacy.
Hi, guys.
So he's going to be, he also works at Nutrichem. So he also happens to be a clinical pharmacist as well. And he's also my husband. So we work together. We often find we come home, we have all these discussions and debates about the different aspects of healthcare that we have. So sometimes we come home and we have all sorts of really interesting talks. So we thought it'd be kind of cool to broadcast one live on Facebook. So feel free to comment or ask any questions kind of as we go, basically. This is going to be recorded so people can watch it at a later date as well. So first of all, we wanted to talk, if you've been following any of the Nutrichem social media, you've probably noticed that we've been mentioning the word deprescribing a lot. So we've been posting on Instagram about deprescribing. We've actually had a webinar in the past in October on deprescribing a certain type of medication, and we're rerunning it because it was so popular in December. So we've been talking a lot about deprescribing, but first we wanted to kind of get a pharmacist's opinion on, so tell us, what does deprescribing actually mean?
Yeah, so just from a basic standpoint, deprescribing is essentially helping patients come off of inappropriate or unsafe medications.
Okay, and so I find this such an interesting conversation, deprescribing, because as a naturopathic doctor, people kind of expect me to have a view of, people should be coming off their prescription medication, which isn't true, or that's not the view that I always have. But as a pharmacist, when your role is actually to give out prescription medications, it's really interesting for you to be kind of actually talking about getting people off of their medication. So what kind of made you want to do deprescribing, or where did that kind of come from?
Yeah, so the classical model of pharmacy is to try to basically dispense as many medications as possible. And what we're trying to do at Nutrichem as drug experts is ultimately, instead of trying to dispense medications, which is part of pharmacist's role, another part of our role, which kind of gets lost, is trying to help people come safely off of medications when it's appropriate and safe to do so. Yeah.
So is that actually a role of pharmacists, though? Do other pharmacists do that?
So right now, very few do. We're one of the only groups in the deprescribing network in Ottawa. We actually just are finishing up a study with Briere Group on deprescribing, with a particular focus on proton pump inhibitor drugs. But yeah, we're part of, I think there's 4 pharmacies in Ottawa as the network, and
that are working to
help deprescribe patients, particularly proton pump inhibitors, or PPIs, which are acid suppressing drugs, really overprescribed, used a lot for just acid reflux. So yeah, that was sort of the initiative, and that's what we've been working on. A lot of people don't know this, but pharmacists were actually some of the first people that created the concept of deprescribing. And we created what's called the Beers list. Beers list is a list of medications that essentially aren't supposed to be used in geriatric patients. And there's also the on-off list, which was also created by pharmacists, which is also for geriatric patients, polypharmacy patients that are on like a ton of medications, to basically help them come off of that. And even today, you hear about like antimicrobial stewardship. So, a lot of our antibiotics are losing their efficacy. So pharmacists have been hugely involved with trying to cut down on antibiotic use. So we kind of see our deprescribing program as sort of an extension of that stewardship in a way. It's just moving into other areas where drugs are really inappropriately used.
Yeah, from my perspective, I get a lot of patients who are on kind of slews and slews of medications, and they're bringing up with me trying to come off these medications, and I'm trying to work with them, but it can be very complicated because it's so controversial. Once someone gets put on a medication, a lot of the time it's extremely difficult to get them off. So even for patients who we see, they don't remember why they were put on a medication. They're not really sure who it's for. They might have been put on a medication when they went to a hospital at one point, and they've been literally just getting it filled for like 3, 4, 5 years, and no one's ever tried to decrease the dose. No one's ever tried to see if they actually need it anymore. But I mean, I think as a naturopathic doctor, sometimes I'm in a little bit of a tricky area, so I have to really communicate with the doctor.
As a pharmacist too, it's definitely tricky, and there are some drug classes that are a lot more controversial. That's partly why we're going with PPIs for now, just because they're acid suppressors. There's not a lot of controversy, and there's not a lot of safety issues with taking someone off of the drug that's often used inappropriately for heartburn. When you can use natural things, you can use diet to reduce people's heartburn. A lot of times people's diets are not exactly exemplary, and they're kind of just using the PPI to suppress acid reflux, when really what they need is kind of like a dietary overhaul, and they're sort of artificially just turning down the stomach acid. Whereas other groups of drugs that sometimes patients are interested in about deprescribing, like benzodiazepines or even antidepressants, become a lot more controversial, and those are areas where we definitely want the medical doctor very closely involved and lots of monitoring. And those are areas that, for the most part, like 95% of the patients we're working with are PPI patients, because they're really overused and there's not really safety issues with getting people
for those
off.
of you who don't know, PPIs are proton pump inhibitors. So Ken McLeod, so the founder of NutriChem, who's also a clinical pharmacist, he did a webinar on what proton pump inhibitors are and why they can be they're not always a good idea to be on long term. So they're actually repeating that webinar in December. So it's Thursday, December 14th at 7 p.m. So next Thursday at 7 o'clock. So if you are on a proton pump inhibitor and you're interested and you've been seeing a lot of this deprescribing and you're listening in, that would be a good idea for you to actually kind of get more into the nitty-gritty details about why we're actually talking about deprescribing and kind of the benefits and harms and that sort of thing. So I also thought it was interesting for us to kind of talk about what a pharmacist view because as a naturopath, again, it's always nice to have a pharmacist on our side when we're talking about bringing someone off a medication, because the more practitioners that are on board and we can kind of get involved in the case, obviously the better for the patient. So what's your general view on what people kind of think about naturopathic doctors and when patients are working with a naturopath to kind of manage some of these things that are, typically managed by medications?
Well, I personally love working with the naturopaths we have, not just because you're my wife, but also just because if you're going to taper patients off of certain medications, you need to provide an alternative. And we've had a lot of success working with the naturopathic doctors at NutriChem. So when we take people off those drugs called PPIs that we talked about earlier, we do have like dietary things we can do with naturopaths, and they can follow up with them. We have nutritionists that we work with at NutriChem. So there's like a whole support team that you can work with. We have a whole line of supplements, one being GI Rescue, that's really useful for tapering people off. And we've also designed the anti-PPI diet. So working with other like naturopaths and nutritionists is super useful, and I think it really increases our success rate of getting people off. Whereas, when we were doing like the study with Briere Research Group, a lot of the other pharmacies struggled a little bit getting people off of drugs like PPIs because they weren't working with other healthcare professionals, so they didn't have a team involvement. So they would try to taper them off the medication without giving them any kind of alternative option.
Which is what we kind of see sometimes. These poor patients are stuck in the middle. So again, if you're listening and you're on one of the medications that we're talking about, if you're on a proton pump inhibitor, yes, it's of course scary. Someone tells you have to get off of it. But then if you don't provide any support or any guidance, then you're always going to come back to having to be on the medication, right? So
for sure. And that's what you see, like when you're coming off of a PPI, people get rebound reflux. And if they don't have some sort of option, they often end up going right back to the doctor, getting another prescription for the PPI, and the cycle continues. So getting people off for good definitely requires a real like healthcare team, for sure.
Right. Yeah. So again, we see this a lot, and something you had talked about in the beginning was Beer's list and the elderly patients. So again, that is something in the clinic we see all the time, is a lot of people bringing their parents in who are on tons and tons of medications and they're really out of it, and nobody knows what to do. Nobody knows, like everybody's too scared to kind of change that. And I know we're talking a lot about the proton pump inhibitors, but can you talk a little bit about the actual deprescribing program that Nutrichem has? Because again, we keep talking about this subject, but we have started a program. Adam's actually the coordinator of the program, so he's kind of working a lot with Kent and getting that going. So let's say you were a patient on proton pump inhibitors or a couple different drugs, and you weren't sure, and your doctor doesn't want to, you're really not sure where to turn to. What do you do?
So right now when people come in, so you can reach me at deprescribing@nutrichem.com, or you can call the pharmacy and get a hold of me.
Just call the pharmacy.
Yeah. And then once you come in, I do what's called a 15-minute deprescribing consult. It's free of charge. And I basically sit with the guideline, the deprescribing and prescribing guidelines from Canadian pharmaceutical guidelines, essentially. And I basically do like a pretty thorough screening where I go through like allergies, medical history, medications. We basically decide if you're a good candidate to be deprescribed. Because as a pharmacist, I'm all for the appropriate use of medications, but in cases where it's just not indicated and it just doesn't make sense, then I'm sitting with the guideline and we can kind of decide, okay, yeah, you're actually a good candidate to come off of this medication. If patients are really complex, then we also offer a lot of like more complex clinical services upstairs in our clinic. And sometimes I refer people up there because they need like a half an hour, a full hour consult and follow-up, and they're more complicated. But for a lot of people, if they're on a PPI, essentially just for acid reflux, I can set you up with almost like a deprescribing PPI starter kit where I sort of give you our anti-PPI diet, a tapering regimen that suits your needs, and then we can go through a couple of supplements that'll kind of help you come off it for good.
Yeah, and I think these areas are so cool because, I mean, as practitioners, it's really cool to be able to talk to nutritionists, other clinical pharmacists, get the opinions of everyone else to see if it's appropriate, what they would do, how to taper, right? Because a lot of people, again, you can't really go from zero, from a lot of drug to none at all the next day. So that can be a really big struggle with people too.
Yeah,
so
a lot of exactly. Coming off of medications safely and effectively is really important. And there's a lot of drugs you can't just stop taking it and it won't work. And that's kind of where pharmacists are really useful. We're drug experts, so not only can we tell you how to take drugs, we can actually tell you how to get off them safely as well. And that's kind of the idea of the deprescribing.
Yeah, which is really, really exciting because, again, I think naturopaths kind of get that bad rap of people come into us and they assume we're going to want to take them off all their medications, or we're never going to want them to start taking some sort of medication. So it's really important, and a lot of the time we'll actually encourage people that they have to stay on their medication, or that actually they might be a good candidate for some sort of a medication because we haven't gotten their targets down yet.
Yeah, absolutely. And I've had the same issue with deprescribing too. Sometimes people come in, say they're on, antihypertensive, so blood pressure medications, and they still have sky-high blood pressure readings. And in that case, the benefits of being on the drug actually outweigh the risks.
Until we can get it down.
Until we can get it down with diet and lifestyle. But there's a lot of times where I just sort of say to people, like, it's actually dangerous for you to come off the drug. And that's kind of the advantage of having a pharmacist. I know when it's dangerous to come off a drug, and sometimes people are like, oh, deprescribing, great, so I'll come in and I'm sure this person's just going to tell me to come off my drug. And sometimes it's actually not a good idea. So that's kind of the idea of giving cognitive services. You can pick my brain and kind of, I'll give you information on how to do it properly if it's safe to do so.
Yeah, and just spreading the word, basically, right? It's so important for people to be aware of, that there are a lot of the most popular classes of medications out there that, aren't indicated for the majority of people that are taking it. And so coming up with a real strategy to help people come off rather than just telling them, you need to get off of this.
Yeah, absolutely. We actually get into the nitty-gritty sort of regimen of what you need to do.
Excellent.
Yeah.
Cool. So deprescribing@nutrichem.com is the email address that you would email if you have any sort of questions or anything like that concerning this at all. It doesn't have to be a proton pump inhibitor. You can just sit down and kind of have, like you were saying, that initial deprescribing.
So if you email me, we can set up a time. I try to be as flexible as possible. I love doing this. I like getting people off of appropriate medications. So if you email me, I'll get back to you.
Mm-hmm. Okay. So you can always call all the information is on the NutriChem Facebook page as well. If you guys enjoyed this, comment. We can do more discussions like this on any topic, really. We're always kind of researching, talking about different things.
Yeah, you're kind of getting a glimpse into our evening
chats, debates. So there is that webinar, though, December 14th at 7:00 p.m. It's only on the proton pump inhibitors, though, and more than the detailed information behind that. All right, so thanks everyone for taking 15 minutes out of your evening to join us. Any questions, we'll kind of comment. Feel free to comment in here. So have a great night.
Bye, guys.
Bye.